My name is John DeBarros, and I will be doing my informed speech on the HIV and AIDS epidemic in Atlanta, Georgia. In Atlanta, this deadly disease has grown through Atlanta outrageously throughout the past 5 to 6 years. It has affected communities tremendously, especially African American communities, which contribute to 70% of the AIDS population, HIV and AIDS population in Atlanta. So mainly because people aren't getting tested and aren't being informed about this disease, this number of people with AIDS and HIV have risen tremendously throughout the years. And I wanted to do my speech on how to inform people about getting tested and the causes of getting HIV and AIDS and the symptoms that you should look at if you are suspected of having this. So first I'm gonna go through the causes, which HIV and AIDS can be transmitted through blood, sexual fluids, breast milk, and sharing needles, which also tie in blood. But I'm gonna go through sharing needles and blood. Really, because we've had a big problem with drug use in Atlanta, this has been one of the main ways of contracting this disease. Because people aren't getting a hold of clean needles, when they use other people's needles as a way of getting this drug into their system, which has been a big problem. But the main one is through sexual fluids. People that don't know they have disease, they'll have sex with somebody and they'll contract the disease through that way, and nobody ever gets tested. And it keeps multiplying. And then also, breast milk comes from that. People don't know they have the disease, so they breastfeed their children, and they end up giving their children the disease. So these are some of the main causes that I found throughout my research of looking through HIV and AIDS. I'm gonna go through the symptoms, so if you're suspecting of having disease or anything, these are some of the symptoms that can help. Well, or if you have some of these, you might want to go get checked, which you should go get tested regardless. Some of these are a simple fever, swollen lymph glands, general arches and pains, swollen lymph nodes, recurrent fevers, fatigue, diarrhea, weight loss, skin rashes, oral yeast infections, or other infections, and shingles. Some of these treatments to treat HIV, which can be treated for and you can get rid of HIV, are through medications, obviously. Also get vaccinations for multiple diseases like hepatitis, exercise so you can keep your immune system strong, keep your body at full health, and blood transfusions, which I read in an article. But AIDS, on the other hand, it's no cure for AIDS. So obviously, if you have HIV, which, well, most people know, obviously, if you have HIV, if not treated, it turns into AIDS over time. It's not a short period of time, but over time it does turn into AIDS. But for AIDS, there's no cure. The only way, really, you have to live with it. But you can live comfortably now because advances in modern technology and medicine. So you can also use medication, obviously exercise, to keep your body healthy. But upon this, I wanted to say, well, to cut it short, because you have to keep the video. Well, trying to keep this video short. I wanted to say, well, Atlanta's been through this a lot. Not through this a lot, but they are probably the worst city in the United States with this problem, with this HIV and AIDS epidemic. It's grown, it's going to keep growing. And the number of people that live, well, according to 2015, the number of people that are living with this, 32,000 people, around 33,000 people in the city of Atlanta alone. And just like I said, the groups that are struggling with this are African Americans and the minority groups mainly. But by getting tested regularly, they suggest around every 6 to 12 weeks, you should be okay. And if you do find that you have HIV, you should get treated for it as soon as possible. And that's my informative speech. My name is John DeBarros. Thank you for listening.